Hi, everyone. Thank you so much for joining me in this continuation of the HIV in View series. My name is Raif Darazi, and I am your host today. We had some amazing conversations in Montreal at AIDS 2022, and now we're continuing the conversation virtually. Today's discussion and topic is around language and the impact that that has on our understanding of HIV and the impact that it has on the stigma around HIV. I am honored to be joined by Laura Waters, HIV consultant and chair of the British HIV Association, as well as Sean Mellers, director of programs and technical positive action at ViiV Healthcare. Laura, Sean, how are you both today?
Very well, thank you.
Very good.
Thank you so much for joining. I appreciate you being here, and I'm excited to jump into this topic that oftentimes gets overlooked because it's so subtle. It's something we use every day. It's around us all the time, and yet we're not always consciously aware of it. So language plays a huge part in shaping our understanding of HIV. Why is the language we use to discuss HIV so important, and what role does it play in fueling stigma? Laura, I'll start with you.
Well, I think we know that HIV is a condition, and people living with HIV are people who face disproportionate amounts of stigma. And I think the language we use in healthcare in general is so important, that referring to people by their condition as opposed to as people or as a person, I think can be very damaging. And it sets up a narrative where a discussion is about a condition rather than the person. So way back in medical school, which is longer ago than I wish to share now, I think. But I remember being adamant that I would never be one of those doctors who referred to somebody as the diabetic in basics or the septic person, that I would call people by their names. But the reality is that is the language that was very, very much embedded. So the way we refer to people by condition starts early on. And I think when it comes to talking about HIV in particular, we need to work extra hard to break down the barriers and to address the issues that are driving some of that stigma. And referring to anybody as an infected person is something that straight away applies judgment to that person, applies fault in some ways. So it's a term that's really become embedded in HIV literature. It remains used in guidelines, in policies, HIV infected person and people. And it's a barrier towards treating people like human beings. So it's something that we are trying to challenge. And I think it's critical if we are to address the issues that people living with HIV face.
Sean, would you like to add anything?
We are people with AIDS. And I think that really emphasizes what Laura just said in terms of using people first language and focusing on the person and not necessarily on the condition, because language is incredibly powerful and it can impact negatively on how the person living with HIV themselves sees themselves and how they operate in the world.
Yeah, I was diagnosed with AIDS in 2012. And I remember, I don't know if it's still accurate or correct at this point, but I know I was told at some point that I'm always considered an AIDS patient. Even if my CD4 count goes up and I'm undetectable and I've been healthy for years and years. And I just thought that was so bizarre. And the idea that I had to label myself as having AIDS still was just, I don't know. It made me feel yuck. Like that's not at all representative of how I feel or what my life looks like.
Mm-hmm. Exactly. And I think perhaps Laura, the clinician, can clarify, but an AIDS definition is a clinical diagnosis. But when I was also diagnosed, there was also the classification of HIV and AIDS, and having a CD4 count of below 200 qualified you to have an AIDS diagnosis. But I think it is about moving away from the labels and working with people living with HIV to understand how be referred to, or how peer educators want to refer to themselves as well.
What has motivated you and given you so much passion to do so much work in this space with language and stigma?
Well, I mean, I think I follow what the community of people that I'm privileged enough to, I can't even say provide care for, I help guide them in caring for themselves. And I respond to what I hear. And when I hear again and again that people just are not listening to calls to use person-centered language, none of this is new. This was raised in the early 1980s. The UN AIDS guidance on appropriate terminology has been out since 2015. Other organisations, community groups, nursing associations have all produced guidance, but it just hasn't gained the traction that it needs. So I've used the opportunity while I am still ViiV chair to set up the People First Charter. So it was on the back of actually the International AIDS Society conference in 2021. And I counted the number of times HIV infected have been used in the context of people or person, it just in the titles and bodies of abstracts in the abstract book. And I got to more than 80. More than one was too much. And it prompted me to sit up till 2 a.m. on a particular website generating program and created the website. And I think by making it very simple, by making it a single issue website, and by slowly spreading the word and asking people to endorse it, and that now includes ViiV as a pharmaceutical company, it includes British HIV Association and other HIV bodies, it includes some journals. It's getting out there. And I think if we can embed consideration of language, so for example, HIV Medicine, which is our specialty journal, now includes a link to the guidance for authors and for reviewers. So we ask both people submitting work and people reviewing that work to refer to the charter as a fairly simple, accessible resource. Hopefully we can start to make a difference, because we cannot preach to people when the very literature on which guidelines and conversations are based uses outdated terminology. So my mission is to start with a journal, start with the conferences, start with the national bodies, and then start correcting people, because it's such an embedded term, it's going to take time.
Yeah, and I remember the Twitter storm, Laura, when you were tweeting from the conference about the term HIV infected. But for me, Raif, as a person living with HIV, I always struggled with the way in which people living with HIV were portrayed in the media or portrayed in images, particularly in the early and mid-80s and early 90s, people living with HIV were always portrayed as looking very thin, very frail, very sick. And I think my worst term is the term AIDS sufferer, which was often used to describe people living with HIV. And I always wanted to shout out, I am not a sufferer. I am not suffering. I am a person who is able, fortunately, and very privileged to be able to live with HIV. And so I think being able to challenge those misconceptions is critically important, because I do think that language has power, and language has power to uplift, but it also has power to dehumanize. And we are in a very privileged position because we speak English, we understand the language, we are relatively educated in terms of scientific terminology, but there are large portions of the community who do not have English as a first language, do not necessarily understand all the scientific or clinical language. So part of that demystifying language is also being able to speak to community in a way that is not patronizing, but in a way that they can truly understand the terminology and the scientific terms, but also are able to contribute and to participate into how the language works for them and how it impacts them.
Yeah, I'm glad you mentioned science, the science community, and the terms that are used as well, because I'm part of a community advisory board that works with scientists and researchers in the field of HIV cure. And our job is literally to absorb as much information and knowledge that they give us, and then repackage, translate that language into something that's accessible by the everyday person. And so I completely understand that as well. And that's equally as important. I think there's so many different areas when it comes to not only healthcare and medicine, but also science and research, and then just how we communicate in the language we use in the community amongst ourselves. There's so many different layers. I do want to ask, moving forward, how the use of more inclusive, more sensitive, accurate language can have a lasting impact for people living with HIV.
It's a tough question, isn't it? I think what we need to do is, I mean, from the beginning, HIV is what I know, and it's language around HIV that's prompted my particular mission. But I think this is something that needs to be embedded across healthcare, because it's not unique to HIV. We've all been dealing with the recent monkeypox, or ongoing monkeypox outbreak globally. And certainly in the UK, for instance, some of the language used related to monkeypox has been far from optimal. There was one particular piece, a patient information page on a national website saying that you could get monkeypox from infected animals or humans. I mean, it's just such a horrible term, this term. And the use of the word infected can be appropriate, infected cells. And it's fantastic that there's always going to be a role for community representatives and advocates to translate scientific language, absolutely. But one thing you shouldn't be having to do is to translate terms like HIV infected into more appropriate terms. That should just be established. So I hope we reach a stage, at least certainly within HIV, hopefully more broadly when we think about viral hepatitis and other sexually transmitted infections, some of the language there. And Sean, as you say, many people are presenting their research, standing up on stage, writing poster abstracts in a language that's not their first language. And I would never stand up at a microphone. I'm happy to stand up at microphones at conferences and challenge things, but I would not challenge someone's language in that particular space, not yet anyway. So I personally think we need to reach a point where the major HIV conference bodies need to have a zero tolerance policy for written materials. And then we move on to trying to improve spoken language. So that would be my vision for now, is that we reach a scenario when nobody living with HIV and eventually other conditions that suffer a disproportionate stigma, no one living with HIV needs to read something that adds to the stigma that they already experience. That we need to just ensure that person first language becomes the absolute norm. And we'll get there. We've already come a long way, and it will just take some more time.
Yeah, to emphasize that a bit, Laura, I do think that because language is one of the main ways in which we communicate our attitude, beliefs, and values, the language that we choose to use can say a lot about us as a person. And so being able to move away from stigmatizing language, because it is particularly in our world around HIV and AIDS and the criminalized populations, there's also the importance of using people first language when we refer to people who use drugs or transgender people, and making a concerted effort to ensure that we practice what we preach, but also understanding that communication is not just verbal. Also how we use the tone of voice, our body language, and our engagement with stakeholders and partners is also important to be able to demonstrate how we show respect for dignity and the worth of all people. So I think language is verbal and nonverbal, and I think that we need to focus on ensuring that the language used is really defined and owned by the communities themselves.
No, Sean, that's so true. And I think, I think I've focused very much on the term HIV infected people or person, but just another couple of examples that should be easy to change. When any trial, and this is beyond HIV, refers to participants as subjects.
Yeah.
Subjects is such a patronizing term. The other one I loathe, and again, it's not just in HIV, is when a control group who don't have the condition under study are referred to as the healthy volunteers.
Yes.
As if the people with the condition, be that HIV, be that obesity, be that diabetes, are somehow inherently unhealthy. Yeah. And again, it's that kind of labeling. It's othering the people with the condition. And there are so we could record for hours on the many examples where language can ultimately make the person at the center of it feel bad.
Yeah,
I'm so excited by everything that you're contributing. I'm gonna take this to my community advisory board and offer it up to the scientists and researchers when we meet. So this is fantastic. Thank you everyone at home for joining us in this latest conversation around HIV and language and the impact that it has on stigma in our community. We will see you in the next conversation. Cheers.